Hello and welcome. Today we're going to talk about something that's really personal and honestly can be pretty confusing for a lot of us, and that's the changes in our intimate health. If this is something that's been on your mind, I just want you to know you're in a warm, supportive space where we can find some answers together.
So maybe you've been noticing things like dryness or just a general sense of discomfort, and it's left you feeling a little worried. It's so easy to feel like you're the only one going through this, but what you're feeling is completely valid, and it's also incredibly common. You are so not alone in this. Honestly, millions of women are navigating these exact same changes a lot of the time in silence. So our goal today is to really shine a light on the options out there and give you clear, empowering information.
Okay, let's dive right in. Now, you may have heard of skin boosters and fillers. They both use hyaluronic acid, which is something our bodies make naturally. But, and this is the most important part, they are designed to do two totally different jobs. The best way to think about it is like this. One path is all about deep hydration and helping the tissue repair itself, while the other is about adding a little bit of soft structure and volume. It's not that one is better than the other, they just solve completely different problems. And just understanding that is a huge first step. So let's start with skin boosters. I want you to imagine them as a long, cool, hydrating drink for your most delicate tissues. This isn't about changing your shape at all. It's all about restoring health from the inside out. Basically, a skin booster uses a very fluid form of that hyaluronic acid to draw moisture deep into the tissue. And what that does is it kickstarts your body's own natural healing process. It encourages it to create more collagen and elastin, the things that keep our tissue plump and resilient. The real goal here is regeneration. So here's how it works, step by step. First, you get that deep hydration, which can bring a sense of relief pretty quickly. Then, the treatment gets to work, telling your own cells to rebuild stronger, more elastic tissue, and that results in a gradual but really lasting improvement in how everything feels. And this is exactly why skin boosters are such a game changer for issues that come from the health of the tissue itself. So if you're dealing with dryness, stinging, maybe that awful paper cut feeling, things that often come along with menopause or after having a baby, this treatment gets right to the root cause. Okay, now let's switch gears and talk about fillers. If skin boosters are that hydrating drink, you can think of fillers as more like a soft, protective cushion. They're designed to add a little support exactly where you need it. Fillers use a much thicker, almost gel-like version of hyaluronic acid. So its job isn't to spread out and hydrate the whole area. Instead, it's designed to stay put and provide structural volume, almost like a little internal support system. So you'd be looking at fillers for different reasons. For instance, if aging or maybe weight loss has meant the outer labia have lost some of their fullness, a filler can restore that natural protective cushioning. And they're also used sometimes for G-spot augmentation to enhance sensation. Okay, so now that we know what each one does, let's put them right next to each other. This is really where you can start to see which solution might match up with your own concerns. And that really is the million-dollar question, isn't it? But it's not about just picking a treatment. It's about listening to your body and asking, does it need hydration and repair? Or does it need a bit of structural support? This comparison makes it so clear. On one hand, you've got skin boosters. Their goal is hydration and repair. They solve problems like dryness or stinging, so they're best for atrophy. On the other hand, you have fillers. Their goal is volume and cushion. They help with issues like chafing or a feeling of deflation, making them perfect for structural volume loss. See? It really simplifies things. There's a huge myth out there that I really want to bust right now. The idea that these treatments are just cosmetic. They're absolutely not. Things like skin boosters are recognized medical treatments for real conditions, like genitourinary syndrome of menopause, or GSM. They're designed to restore function, relieve pain, and truly improve your quality of life. A journey like this is so personal, and it really requires a guide who's not only an expert, but also incredibly compassionate. And that's why finding the right clinician, someone like Dr. Farzana at the Women's Health Clinic, is probably the most important step you can take. This quote really captures Dr. Farzana Khan's entire philosophy. Her approach is a partnership. It's built on making sure you understand everything, you know exactly what to expect, and that you feel completely empowered to make decisions about your own body together. And her dedication is just so clear. We're talking about over 20 years of medical experience, a special diploma in sexual and reproductive health, and for years now, she's been focused specifically on regenerative medicine for women.
In fact, since 2023, she's been training other doctors in these advanced techniques. She's a true expert. So, now that you have all this information and this clarity, what's your next step on the path to feeling better? Well, it often starts with some simple foundational care that really honors your body.
Before you even think about a procedure, it's a great idea to start right here. Protect your body's natural balance. Use gentle, pH-balanced products and steer clear of things with harsh scents. Stay hydrated, and most importantly, talk to a specialist, like the team at the Women's Health Clinic, to get advice that's tailored just for you. I really want to leave you with this thought because it's so important. Your physical comfort is not a luxury. It's not something you should just put up with. It is a fundamental part of your health and your well-being. It is absolutely your right. So I'll just end by asking you to think about this. What would it feel like to really reclaim your confidence and feel completely at home in your own body again? I hope this has given you a little bit of hope and a clearer path forward. If you want to learn more, I encourage you to visit the Women's Health Clinic and book a consultation with Dr. Farzana.